Hello, my name is Dr. Ominde, and in this lecture series we are going to discuss the tongue, the palate, and the pharynx. The tongue, the palate, and the pharynx. So you need to understand the gross anatomy of these three structures. You should know the parts, the muscles, neurovascular structures, lymphatic drainage, and some applied aspects. So the tongue is made up of striated muscle. So it's made up of skeletal muscle, and these skeletal muscles are covered by mucous membrane, which has stratified squamous parakeratinized epithelium. The muscles on the right and left side are separated by a median septum, and the tongue has three parts. It has an oral part, which is the anterior 2/3 there, followed by posterior third, and lastly the root or the base of the tongue. And it has two surfaces, the dorsal surface, where if close to the palate, and the ventral surface that faces down or beneath. The dorsal surface, when you protrude the tongue, the rough surface that you actually see is the dorsal surface, while the ventral surface is the lower part, which is smooth. So the dorsal surface is divided into anterior 2/3 and posterior 2/3 by a V-shaped sulcus terminalis. So this is the sulcus terminalis, this is anterior 2/3 and posterior third. So the apex of this sulcus faces backwards, as you can see, and it's usually marked by a pit, which we call the foramen cecum. This foramen cecum is usually the embryonic remnant, and it marks the site of upper end of thyroglossal cyst. Remember, thyroid gland descends from this foramen cecum downwards to the anterior part of the neck, and it's usually connected to this part of the tongue by a thyroglossal duct. So when the thyroglossal duct, normally it's supposed to degenerate. So this foramen cecum is just an embryonic remnant of this site, the upper end of the thyroglossal duct. The dorsum of the tongue on the anterior 2/3, it's usually rough because of the presence of the papillae. So we have different papillae, fungiform papillae, foliate papillae, and we have what you call the valate papillae or circumvallate papillae, and these are arranged anterior to the V-shaped sulcus terminalis. The posterior 1/3 has no papillae, though it shows nodules, lymphatic nodules, which you call the lymphoid tonsils. It contains lymphoid follicles that guard the oropharynx against microbes or pathogens. The ventral surface of the tongue is smooth, it's found underneath, it has no papillae, and in the midline, it's connected to the floor of the mouth by a frenulum, so we call it a lingual frenulum. So lateral to the frenulum, you see what we call the deep lingual vein on both sides, and you can actually see through the mucosa. And lateral to the lingual vein is what we call the plica fimbriata. It's a fold of mucosa, plica fimbriata, as you can see in this image. So the muscles of the tongue are divided into two. We have the intrinsic and extrinsic muscles. Intrinsic muscles are within the tongue. The origin and termination is within the tongue. Extrinsic muscles are originate from the surrounding bones to the tongue. Okay, like you can see, this is coming from the genu of the mandibles or genioglossus. Then you'll find muscles from the hyoid to the tongue, hyoglossus. From the styloid process to the tongue, styoglossus. So those are extrinsic muscles. So intrinsic muscles are confined to the tongue and they have no bony attachment. So you have longitudinal muscles, you can see. They run parallel the whole length of the tongue. Then you have transverse muscle traversing from mediolateral, okay? And then you have vertical muscle. You can see they are vertically oriented. So these are intrinsic muscles, and their main function is to alter the shape of the tongue. They alter the shape of the tongue. Then we have extrinsic muscles. These connect the tongue to the surrounding structures. So the tongue to the palate, palatoglossus muscle. The tongue to the genu of the mandible, genioglossus. The tongue to the hyoid bone, hyoglossus. This is hyoglossus, genioglossus, okay? then to the styloid process. This is the styloid process to the tongue, styloglossus. And the main function of these extrinsic muscles is movement of the tongue. Intrinsic, they change the shape. Extrinsic, they help to move the tongue. So what type of movements are we talking about? To protrude the tongue, to bring the tongue out of the mouth, that's by genioglossus, right and left. Now, the mouth is out of the tongue. To bring it back, that's what you call retraction, and retraction is by styloglossus and hyoglossus on both sides. Then to bring the tongue downwards, it's carried out by hyoglossus and genioglossus, and to elevate the tongue, that's carried out by muscles whose origin are above the tongue, such as styloglossus and palatoglossus. So, for instance, if you're to look at this image, the extrinsic muscles are the ones that move the tongue. So we said to retract, if this muscle contracts, they contract from insertion towards the origin. If you contract this way, you pull the tongue outwards, and that's why we said that the protraction is by genioglossus. Then retraction is by styloglossus and hyoglossus. So if your tongue is out and you want to bring it back in, styloglossus will contract this way, okay, and hyoglossus too will contract and pull the tongue backwards. So they cause retraction. Then depression, if hyoglossus contracts, it will pull the tongue downwards, and if palatoglossus and styloglossus pull upwards, it will cause elevation of the tongue. So you can work it out without cramming, as long as you know where the muscle is coming from. Sensory innervation of the tongue. So if you're asked to write an essay on innervation of the tongue, you have to divide it into motor sensation and sensory sensation. Sensory sensation is usually divided into two. We have two types of sensations. We have general sensation, where you feel pain and temperature. For example, if you take hot tea, you feel the heat and then you feel pain out of being burnt. So that's general sensation. And special sensation is tastes. Okay, whether it's sweet or sour, that's special sensation. So you divide the tongue into three: anterior 2/3, posterior third, and the base. And this is based on the different embryonic origin. The different parts of the tongue come from different embryonic origin in terms of the pharyngeal arches that contribute in the development of the tongue. So the general sensation of anterior 2/3 is bilingual branch of mandibular. General sensation of anterior 2/3, lingual branch of mandibular, and special sensation of this region is by coda tympani from facial. Okay, facial is the 7th cranial nerve. Posterior third, both general and special sensation are from glossopharyngeal, which is the 9th cranial nerve. And then the base of the root of the tongue, both general and special sensation are by a branch of the 10th cranial nerve vagus, which is internal laryngeal nerve. So general, you have to divide it to the different parts: anterior 2/3, posterior third, and the base. So it's only in the anterior 2/3 that the general and special sensation are different. General sensation bilingual of mandibular, and special sensation by coda tympani of facial nerve. Motor sensation of the tongue. All muscles of the tongue are supplied by hypoglossal nerve except palatoglossus, which is supplied by pharyngeal plexus. So that's the most important statement about motor innervation of the tongue. All muscles of the tongue, both intrinsic and extrinsic, are supplied by hypoglossal nerve, which is the 12th cranial nerve, except palatoglossus, which is supplied by pharyngeal plexus. What's the blood supply of the tongue? The blood supply of the tongue is mainly by branches from the external carotid artery. So the main one is lingual artery. Then we have tonsillar branch of facial artery and ascending pharyngeal artery. So lingual artery, facial artery through tonsillar artery, and ascending pharyngeal artery. All these are from external carotid artery. And then the lingual vein drains into the internal jugular vein. What's the lymphatic drainage of the tongue? At the tip of the tongue here, they will drain anteriorly and downwards to the submental lymph nodes. And then the sides of the tongue drain into the sides at the submandibular lymph nodes, while posterior third of the tongue drains into the deep cervical nodes, which we call the jugulodigastric lymph nodes. So submental, submandibular, and deep cervical via the jugulodigastric nodes. So you have to divide it again If you ask the lymphatic drainage, don't just mention, you have to say which part of the tongue drains where. What are the functions of the tongue? Speech, help you to articulate your words. Taste, different types of taste, like bitter, that's where you sense it. At the sides, you have the salty and sour. Then at the front, the tip, there is a sensation of sweet taste. Then we have deglutition. The tongue helps in swallowing. It will help you form a food bolus and push the bolus backwards towards the pharynx and facilitate swallowing. What are the clinical aspects? You can have laceration of the tongue, like in trauma. You can have ankyglossia, which is tongue tie. This is whereby the frenulum extends to the tip, the front here, the tip of the tongue. Therefore, the patient cannot even protrude the tongue. This is mainly noticed in newborns, and usually when you notice this as the newborn is crying, you can just incise and take the frenulum. You cut this portion so the frenulum recedes backwards. Then, lesion of hypoglossal nerve. When the tongue, you tell the patient to protrude the tongue. If there is lesion of right hypoglossal nerve and you tell the patient protrude the tongue will deviate towards the right side, towards the side of lesion. This is different from facial nerve. Remember, we talked in the face, muscles of facial expression, we said when there is lower motor neuron lesion involving the facial nerve, and you ask the patient to smile, the face will move towards the normal side because the muscles there are working, so they push the face to contract towards the normal side. Here in hypoglossal, when there is lesion, the tongue protrudes, when you ask the patient to protrude the tongue deviates towards the side of lesion, not the normal side. And then it appears like you have wrinkles and atrophy of muscles on that side of the tongue. So thank you very much. In the next slide, we'll discuss the palate.